we have a 26 weeks gestational age infant who is intubated and ventilated since delivery. He is 8 hours old, and the second dose of surfactant was given 2 hours back. He was switched to HFO because of for CO2 retention, and the mean BP is 35, and the SpO2 is 90. On examination, he has a good chest wobble and equal air entry. The ventilator settings were as follows: mode is HFOV with a map of 14, with an amplitude of 30, and FiO2 is 0.5 with a rate of 12 Hz. And his chest radiograph is next slide, as shown in like this, and the ABG is the next. pH is 7.1, PaCO2 is 80 with a PaO2 of 65 with a bicarb of 11.4 and base excess of minus 10.2. Can anyone read the ABG?
ABG and X-ray as well. Okay. Who wants to answer? Dr. Priyanka?
I can do, sir, if nobody's answering.
Yeah, please.
Yes.
Please.
So maybe you have.
Sir, it is the
Okay, Priyanka can answer. Okay.
sir, the X-ray slightly shifted, rotated. I think film is rotated,
Okay.
and
How is the ET tube?
on the right side there are opacities, homogeneous opacities, and ABGA shows
Just 1
mixed.
second. You didn't finish the X-ray yet. I mean, how is the ET tube on the X-ray?
Yes, sir. ET tube is little high.
How do you say little high? I think it's fairly high.
Yeah, fairly high, yes, sir. It is fairly high as it is.
Dr. Akshatha, is it a real case or I mean, just for the presentation?
No, sir, just for presentation I have taken. One
Okay,
point is
was the tube adjusted in this position? Because before shifting to high frequency, you need to optimize the support. So maybe that was the reason. I mean, the ventilation was not adequate because the tube is high. It's almost probably sitting at the vocal cord level.
Yes,
yes, sir.
So that's a very important point, that the tube position is important. And what about the neck position in relation to the tube position? So in this baby, would you prefer the neck extended or flexed?
It should be neither too flexed or neither too extended, sir. It should be.
In this tube position, which position would you prefer? I mean, I know the neck is in the midline, but an extended neck
Yes,
takes
sir.
the tube further out. Okay. So
Okay.
flexion of the tube takes it inside and extension will take it more outside. This tube is
Yes, sir.
already high. So primary reason, if it is the same baby as being discussed, then the tube position itself could explain. So before you escalate your settings, you need to adjust the tube first. So look at these aspects carefully. What about the feeding tube? Are you comfortable with the feeding tube position?
But it is slightly lower.
So it's a little bit high as well. If what I think is a tip, I mean, I don't know whether the end is here or it's a artifact. We need to check on the system. But if it is just at the start of the bubble, then it needs to go in. But there is a little artifact going down also. So we need to check on the system and clarify. So I'm not sure which
Yes,
exactly is the tip of the feeding tube. So the X-ray is like RDS, but the tube is high. That's the most important finding here. The ET tube is high. You're talking of a baby with difficult ventilation. So the first step in this case is to push the tube in to the right position. So, yeah.
Sorry, doctor. There is no umbilical line, yes? I don't see the umbilical line.
That's okay. I mean, there's no umbilical line. That's fine. I mean, it depends on the setting and maybe they have a PIC line from the leg. Anyway, that's different, not part of the discussion. The blood gas now, Dr. Iriska, do you want to take the blood gas?
Okay,
Am I saying your name correct? I mean, is it Iriska or?
It's Ireska.
Iriska, sorry. Yeah.
Okay, it's okay, sir. I think this one should be a mixed acidosis.
Okay.
So I can see that there's some
You grade it?
retention.
Would you grade the severity?
I'm not sure, sir.
It's severe, isn't it? pH is low, both.
Yes, I mean, yes, it's severe, yes.
So it needs urgent intervention again. And in this case, obviously, baby is on high frequency. What changes would you suggest? You have both metabolic acidosis, which is significant, and respiratory acidosis. Of course, you would correct the respiratory component because the pH is below 7.2. So you want to correct it, and you would correct the
I think I would try to change the setting, maybe this is a 26 weaker. So if it's possible, maybe we can increase the amplitude first to 35, or I think the frequency is quite on the lower side for this patient, but if possible, we cannot do any other thing, maybe we can lower the frequency to 11. Probably, I'm not sure about the corner frequency for this one.
Okay, Dr. Akshatha.
Yes, sir. Since there is both mixed severe metabolic acidosis and respiratory acidosis. First, regarding to take care of the respiratory acidosis, we will change the respiratory rate of this one. With first, we will begin with 10 hertz. Even if the acidosis will not correct, we can decrease the rate further to 8, sir. And for the metabolic component, we have, like, the baby was already on the inotropes. Like we have to see the inotropic support, whether it is properly getting.
Okay, and the fluid balance as well. So is it necessary to switch over? So if you had picked up the tube problem, maybe you would not have switched over. It's reasonable to switch over, but if the tube was high and you're not getting the right ventilation, maybe you could have adjusted the tube first. So that would have been your first step as well.